Welcome to MedicoApp's short concepts. So today we'll be discussing a question. So before starting a question, I request you to please subscribe our channel and hit the bell icon so that whenever we post any new videos related to this thing or any concept or any question discussion, you will get notified. Okay, so without wasting our time, let's start with the question. Now here you can see this image. So basically this image is of OPG. First and foremost thing, you should know that this is an OPG. Now, the question is diagnose the given radiograph. So before starting with the diagnosis, you should know how to see the OPG. So let's start with the first quadrant. This is first quadrant. This is second quadrant. This is third quadrant. This is fourth quadrant. Now start from this 1-8. Okay. This appears to be normal. This appears to be normal. Okay. Everything seems to be fine only. Then on this second side, this seems to be fine. Now here they are pointing arrow toward this thing. That means that there is something here in the third quadrant, right? We'll discuss about this. And this is the fourth quadrant, right? So this is the mandible, complete mandible. I'm just drawing the outline. Here also, this is the condyle, ramus, inferior border of the mandible. This is maxillary sinus. At UG level, this is sufficient for you guys to know. Now, this pathology. Now, here you can see this tooth embedded. So, first of all, whenever you are describing any lesion, you should know the extent of the lesion, that how much is it is extending superior, inferiorly, anterior, posteriorly, what all it is invading, and what is the surrounding structure. Now, second thing is what all lesion you can see in posterior mandible. So when I say that any lesion which is extending and this expansile, what all you can think? First of all, it could be ameloblastoma, right? Second, since it is involving this tooth, it could be dentigerous cyst as well. Then third, it could be myxoma as well. Okay, let's consider these three things. Now, ameloblastoma. In ameloblastoma, the classic thing is multilocular appearance. Okay, multilocular appearance, which is not seen here. Though ameloblastoma can be unicystic too, but the classic appearance is honeycomb pattern or the soap bubble appearance. Now, dentigerous cyst. It could be dentigerous cyst because it is involving this tooth as well. Okay, and third is myxoma. In myxoma, you will see like tangential pressure, tangential thing crossing the line. Usually multilocular appearance will be there, and there will be tennis racket appearance in cases of myxoma. So obviously it could not be myxoma, but it could be considered as a differential of this dentigerous cyst, right? Now let's see what all findings you will see in dentigerous cyst. So first of all, dentigerous cyst, it is also known as follicular cyst. Follicular cyst. Now the normal thing, when to say that it is normal follicle and when to say it is cyst. So if it is 3 millimeter, it could be normal follicle. If it is extending more than this, then it is said to be cyst, right? Now, dentigerous cyst, it is the most common pathologic pericoronal radiolucency of the jaw. I hope radiolucency and radio opaque, all these terms, they are clear to you, but radiolucency means black. Radio opaque means white. This is for the UG students, if in case if you don't know. Then second is, it is associated with the crowns of unerupted or the developing tooth. So it favors the diagnosis since it involves this tooth and third molar, right? So this could be dentigerous cyst. Now, what all findings you tend to see radiographically to confirm that this is a dentigerous cyst? Before that, let me tell you that there are three varieties of dentigerous cyst. It could be central, like you can see how beautifully it is engaging the tooth, and it is starting from this cervical point. Second, it could be lateral. You can see this is asymmetrical. So this is lateral variety. And the third is circumferential. Though it is starting from the cervical margin only, but it is enveloping the entire tooth. So this is the circumferential type. So these are the three types of dentigerous cyst. Now coming on to the specific thing, that is the radiographic features to confirm the diagnosis, because in this question they are asking just about the radiographic diagnosis. So it consists of a well-corticated pericoronal radiolucency. Like here you can see, this is the radiolucency. Then the cystic cavity often originates from the cervical region. As I already told, it is also involving from the cervical region. Then most lesions, they are unicystic, but there are cases where we can see this multilocular appearance. But like 90% of the time, it is unicystic, and it is generally seen in second and third decades of life involving the third molar, right? Now, before I tell you further things, let me tell you that if you want to get updated for such posts and such video lectures, you need to subscribe our channel, and you can even go to this www.medicoapps.org.groups. So specifically, we'll be sending these videos as per your year. Like if any student is in first year or second year, we'll be posting such updates, and this is limited. So you can just go and subscribe to this thing, so that you will just get notified whenever we are posting anything in groups, right? So you can just subscribe this thing. And this is the short concept. So we are just discussing about the radiological diagnosis, how to confirm whether it is dentigerous cyst or any other thing. So you should know the differential diagnosis whenever you are telling about any lesion. Moreover, dentigerous cyst will be dealing the clinical feature, appearances, and the pathological part in other classes. Hope you have liked the class, and please, I'm again reminding, just subscribe the thing and just hit the bell icon. Hope you like the class. Thank you.